This is the second of a three-part series on the prescriptions for survival that we have issued through the World Mental Health Coalition. The first one, issued in March 2020, dealt exclusively with the COVID-19 pandemic. However, by December 2021, after no action had been taken against the former president for his instigation of an insurrection in January of that year, a different kind of prescription was deemed necessary. Hence, we issued the following: Prescription for Democracy's Survival. It said, "We are all mental health professionals. We are committed to public mental health and the Universal Health Professionals Pledge, the Declaration of Geneva. We have warned since 2017 about the dangers of Donald Trump as president, not because of his policies, but because of his mental impairments, which have the risk of spreading among his followers if kept uncontained." We held an ethics conference at Yale School of Medicine in April 2017 with the nation's foremost psychiatrists, which led to the public service book, The Dangerous Case of Donald Trump, by the end of 2017. Thousands of mental health professionals have since joined us to form the World Mental Health Coalition. We held a major interdisciplinary conference at the National Press Club in March 2019, with 13 of the nation's top experts in fields such as law, political science, nuclear science, and climate science to underscore the variety of dangers Donald Trump's mental impairments posed. We issued a prescription for survival in March 2020, addressing his mental unfitness to handle the impending pandemic and the unnecessary deaths that would ensue. And finally, we issued a video statement in October 2020 of 100 senior mental health professionals declaring his mental unfitness too dangerous for his continued presidency and candidacy for re-election. Now we conclude it is our urgent responsibility to inform the nation of what we consider to be a prescription for democracy's survival. Instead of proper intervention to contain and improve Donald Trump's serious and dangerous mental defects, as a president of any other major institution or corporation would have faced, his impairments have been coddled and enabled. The end result is that the foundational fabric of American society has been undermined to the point of seriously endangering our democracy. Our prescription is one or a combination of the following. Number one, immediate arrest of the former president, as should have been done within days of the insurrection of January 6, 2021, to prevent further spread of criminality and violence. Number two, aggressive prosecution of the former president with televised hearings of the proceedings, with the U.S. Department of Justice realizing that its process affects the very mental well-being of a nation. Number three, immediate investigation of those who have broken the law to co-conspire with the former president, either in his efforts to overturn an election or in his mismanagement of a global pandemic that has resulted in approximately 800,000 confirmed deaths. Number four, emergency and voluntary mental health evaluation of the former president by an independent team of medical professionals qualified to address his danger to others and to the public. Number five, complete removal from the former president any possibility of future participation in political life through the invocation of appropriate laws forbidding those who engaged in insurrection or otherwise assaulted the nation from holding office. And suspension of the former president from media platforms that allow his lies, false beliefs, and hateful messages to spread. So that was the prescription for democracy's survival. It said the start of this prescription is stat. Compliance could save our democracy. Issued on December 6, 2021, and effective until fully executed. There have been great consequences of the first Trump presidency. Some of them I've called Trump contagion, to illustrate the spread of fixed false beliefs, paranoia, violence, and criminality among Trump followers. as well as to describe the spread of belligerence and brutality in international affairs and multiple other domains. For example, the Russian invasion of Ukraine in February 2022, seemingly senseless at the time, may not have occurred without Donald Trump's first term. Hence, in March 2022, we issued our Prescription for Survival 2022 with the following mandate. Now, at this 2-year anniversary of our initial Prescription for Survival, we are confronting multiple emergencies on many fronts. The gross mishandling of the pandemic has further exacerbated economic inequalities and resulted in tragic failures to deal with a severe climate crisis. Global conflicts are accelerating, even raising the risks of thermonuclear war. Furthermore, we now face an increased likelihood of a new COVID variants coming from impoverished countries with low vaccination rates and limited public health capacities. Underlying this ominous world situation is an overall crisis of collective mental health, about which we recently stated, our social, economic, and political system is driving us to collective suicide. However, there are ways to confront this dire situation. We must recognize that there is a major mental health pandemic, now reaching critical proportions in the United States and other countries, manifesting in the rates of suicides, homicides, and collective violence. When a lack of critical remedial action and augmentation only of exacerbating factors becomes a threat to the survival of our species, we unmistakably enter the domain of medicine and mental health, which is the reason for our prescription and professional intervention. So our 5 new and expanded prescriptives include: Number 1, emergency funding is necessary for vaccinating the entire world against COVID-19 in the shortest possible time. The sooner we do this, the more effectively we can protect the global population against further devastating COVID outbreaks, variants, and prepare for possible new pandemics. Wealthy nations have selfishly and short-sightedly hoarded vaccines in ways that have caused large regions of the world to be minimally vaccinated and therefore cause more contagious and potentially vaccine-evading variants that then spread worldwide. The cost of rapidly implementing this remedial recommendation is less than the normal increase of the U.S. military budget this year alone, making it by far the most cost-efficient way to protect everyone. Number 2, urgent steps must be taken to rescind the misnamed free trade and globalization policies the wealthy North has wrongfully and deceptively pursued for some time. These policies have grossly benefited rich nations and megacorporations at the expense of real free trade and global well-being. If we can successfully reverse these self-serving and onerous policies that have escalated inequality and injustice, we will at the same time improve global mental health as well as support the foundation for democracy everywhere. Number 3, immediate attention and education are required to deal with the serious problems resulting from the elevation and empowerment of psychologically dangerous national leaders. It is estimated that such dangerous individuals occupy 10% of power positions worldwide, while being responsible for 90% of global atrocities. In a multidisciplinary way, professionals must work together to contain this crisis, which contributes to the spread of criminality, violence, economic dislocation, crumbling institutions, deaths, drug misuse, and a widespread culture of psychological abuse for political gain. Number 4, immediate steps are needed by all nuclear weapons possessing nations to ratify and implement the 2017 Treaty on the Prohibition of Nuclear Weapons. The currently still expanding MAD, or Mutually Assured Destruction, state of world affairs must urgently be declared incompatible with life. We must transform our world into being nuclear weapons free with a rejuvenated and strengthened United Nations and potent international law institutions. Number 5, implementation of the 2015 Paris and the 2021 Glasgow International Climate Agreements, as well as the recommendations of the alarming United Nations Intergovernmental Panel on Climate Change reports, is imperative. Widespread denial of scientific truth, gross governmental malfeasance, extreme corporate disinformation, and unconscionable capitalistic excesses are propelling our world with accelerating speed to climate catastrophe. Sustainable habitability of the planet must now be humanity's urgent priority, requiring unprecedented emergency measures. That was the Prescription for Survival, 2022. And it said, the reason for this prescription is hope. The timing of it is stat. Compliance is required for the survival of our species. Later in 2022, we issued the following October update. We said, now, in October 2022, with about 1 of every 300 Americans dead from COVID, and with nearly 500 persons still dying daily of COVID, the United States has still not taken the necessary steps as urged by the medical and scientific experts. Consequently, we feel the imperative to add the following important additions to our previous prescriptions. Number 1, a full and complete investigation into the true origins of COVID. If the government will not fully and honestly pursue this investigation, the academic and scientific communities, as well as the major media, must do so independently and vigorously. Number 2, recognition that the pandemic is not over. Our previous recommendations to empower and substantially increase cooperation and funding for the World Health Organization, as well as to insulate the National Institute of Health, the Centers for Disease Control and Prevention, and academic experts from political and pharmaceutical company interference take on ever greater urgency. Number 3, assurance of mental health in the highest positions in the nation wielding presidential powers. We renew our plea to the leaders of our country that basic mental health standards be applied to the U.S. presidency and those in the immediate line of succession, and that the reforms be made to the 25th Amendment so as to render it actually usable and not just theoretical. So that was our October update of 2022. And we can imagine the hardships we would have avoided and could avoid still were we to heed these prescriptions. They are not just edicts, they are a reshaping of our attitude and outlook of the world. Of course, there is the issue of what a dear political scientist colleague, Richard Falk, has recently highlighted as the transition problem, the challenge of transitioning from an unjust, destructive system to a just, life-affirming one. And that is precisely what we're trying to address in this series. We will discuss these approaches this next week when we present our Prescription for Survival 2025.